The National Primary Healthcare Development Agency has on Tuesday briefed newsmen in Abuja on the importance of vaccination in tackling other variants of COVID-19.
Globally, we saw the emergence of new variants, such as the IHU variant in France, which is said to have 46 mutations, Delta Cron in Cyprus, and the Omicron variant still being highly infectious, with the BA2 subvariants rapidly spreading. Most of our citizens are coming down with the infection. Luckily, for our vaccinated population, those who came down with the COVID-19 infection had only mild symptoms, which they managed at home due to the immunity the vaccination provided them. If they were not vaccinated, we cannot predict how these cases would have turned out. Vaccination prevents you from severe disease, hospitalization, and death. The reason for the emergence of this variant is because there's still a large proportion of the eligible population who have not yet been vaccinated, and this has given the virus time to mutate and fight back. It is important that we protect ourselves and our loved ones by getting the jab. Our vaccination exercise was expanded to enable all eligible Nigerians have easier access. All vaccination sites are open to eligible persons 18 years and above for first, second, and booster doses. We call on all Nigerians to avail themselves of this opportunity in the ongoing mass vaccination exercise to get vaccinated against COVID-19.
The Executive Director, Dr. Faisal Shuaib, said the agency is planning to integrate the campaign with childhood immunization so that children between 0 to 23 months can get immunized.
In this phase of COVID-19 mass vaccination, we plan to integrate the campaign with childhood immunizations and other primary healthcare services. What this simply means is that alongside the COVID-19 vaccines, childhood vaccines will also be available at the COVID-19 vaccination sites. Consequently, parents and guardians with children aged 0 to 23 months are urged to take them along to the vaccination sites. The childhood vaccines protect against polio, whooping cough, measles, yellow fever, tetanus, tuberculosis, and other childhood preventable diseases. This is to ensure that while we are trying so hard to control the transmission of COVID-19, we do not neglect other PHC services or even have outbreaks of childhood vaccine preventable diseases on our hands.
He also said the state performance revealed Nasarawa, FCT, Jigawa, and Kwara State as the top 5 performing states in COVID-19 vaccination uptake.
Our deep dive into the state's performances revealed that Nasarawa, Jigawa, the Federal Capital Territory, Ogun, and Kwara states have remained the top 5 performing states on COVID-19 vaccine uptake. It is noteworthy to mention that Jigawa and Lagos states have each vaccinated about 1.5 million eligible Nigerians with the first dose, while the FCT, Nasarawa, Lagos, and Delta are leading on second dose administration with more than 10% of their eligible populations already vaccinated. On the walls of this hall, you can see the state performance charts displayed. It is in our spirit of transparency and accountability that we consider it important to keep Nigerians informed about the progress of COVID-19 vaccination in the states. We also believe that this information will serve as an encouragement for the states in the vaccine uptake going forward.
The challenge now is to ensure that we remain at a minimum of 200,000 a day, but increase that to 300,000 a day so that we can meet our target during the course of 2022. Some states at Nasarawa, Jigawa, FCT, and Lagos, Ogun have done, and Kwara have done exceptionally well. I would call on the governors of the other states to revitalize their efforts to try and ensure that vaccines are not only available, but people of vaccines port to arms, as I call it, so that the arms are available to utilize all the vaccine that is available. On vaccine, we're very pleased to announce that Nigeria now has received over 60 million vaccines. In 2021, just over 40 million were received, and so far in 2022, 21.9 million vaccines have been received and given to Nigeria.
Dorcas Olariwaju, Voice TV, Nigeria.